Hi there, this is Dr. Evan Osar with Integrative Movement Institute. Happy Sunday, hope your weekend is going well. Did you know that May is Osteoarthritis Awareness Month? And osteoarthritis is the #1 cause of physical disability in the world. And did you know that you as a health and fitness professional are in the #1 position to help clients with osteoarthritis? Because what is the #1 thing that individuals with osteoarthritis should be doing? Yes, physical fitness and specifically resistance training. And oftentimes these things are thought to be counterproductive, meaning like resistance training actually will start to disrupt or cause further degeneration of the joints. And actually nothing could be further from the truth. Yes, of course, if your client is doing excessive exercise for their ability to align and control their joints, or if they're doing exercise that's inappropriate for their level of conditioning, it can further degenerate their joints. Or if your client isn't recuperating well enough, or their nutrition isn't supporting their joint health, obviously those things can impact your client's joint health. However, a properly structured program can help your clients actually improve joint health. A properly prescribed and written program can be the #1 thing your client can do. Meaning that when you help your clients identify their suboptimal habits. So what are these suboptimal habits? It's things like forward head posture, because this will put more stress on the joints of the lower neck. Not only does it do that, for example, my wife was just sharing with me just this morning that how the link between the forward head posture and jaw pain, for forward head posture and abdominal distension. So we know that these things that impact our posture also impact the stress upon different areas of our body. The more we change joint alignment, so if we're loading a joint in a suboptimal position, there's an optimal position to load all our joints. And that does not mean that we're always going to load our joints the same way or the appropriate way every single time throughout life. However, a good portion of the time, 75 to 90% of the time, we should have our joints in the proper position or optimal position for loading, and we should have the right motor control. Motor control is how your nervous system aligns and controls the joints for posture and for movement. So the #1 thing that you and I can do as posture and movement specialists is help our clients better align. First, identify the reasons why they're not aligning and or controlling their joints well, and then help them better align and create more optimal joint control or control around their joints. And again, for many of our clients, it's sort of like this analogy that I often give when we teach in our integrative movement specialist program is bend your finger back like this, okay? So just imagine this is your spine, for example, and you can feel the stress on your finger as you do that. Now, unbend it just enough so that you release some of the tension. You didn't have to fully straighten your finger to relieve a lot of that tension from the finger being bent back. And for a lot of your clients, especially your older clients with hip and or knee osteoarthritis, it isn't about creating perfect posture. There's no such thing as perfect posture. There is a more optimal position for posture, for loading, for positioning and loading the joints, like the hip joint or the knee joint or the spine for that matter. And if we can help our clients move, kind of like this finger here analogy, if we can help them move closer to a more optimal position, we can help those clients and then also educate them about the importance of movement, and that movement isn't causing further degeneration to their joints. In fact, I'm working with an 86-year-old woman, beautiful woman, just awesome woman. She was a little skeptical when she came in to see me. She's like, I don't really know if chiropractic can help. I've never been to a chiropractor, never been to physical therapy. She's 86, never been to chiropractor or physical therapy. So she was a little bit skeptical about whether or not chiropractic could help her knees. But again, I just shared with her, this is what we can do. We can address the issues, the posture and movement issues that may be putting more stress upon the knees. I'm not planning to take away the pain out of her knees. I'm just trying to help her better align and control her joints. So she came in yesterday. She'd been away, she'd been sick, and then she'd been visiting family. So she was out for about 3 weeks. And she came back and she's like, my knees still hurt. However, I feel like I can do stairs better. I feel like I'm moving better. I feel like I can get out of the chair easier without the stiffness of those first couple steps. So she's like, I'm going to continue with it. This is. I actually believe this is working. So she's an amazing woman. She's 86. She's like, yeah, I want to keep up with my mother who's 106. So she's got great genetics on her side. Genetics also plays a role in this. However, it's important that you educate your clients that it's not just about genetics. Here's a woman who's been physically active her entire life and hasn't really sat down and been sedentary at any point in her life. So it's important we educate our clients about the importance of optimal posture movement and helping our clients get to their most optimal, even though it may be different for an 86-year-old person than it is for a 36-year-old person. Because we have 11-year-old, 12-year-old girls that come in to see us, to consult with them that have chronic hip problems. They have bone spurs. They have degeneration of their cartilage or tearing of their cartilage, wearing down of their cartilage. That's osteoarthritis in 11 and 12-year-old athletes. So it's happening even at young ages. So one of the things we want to do, one of the most important things we can do as health and fitness professionals that you can do is, number one, educate your clients. This is May is Osteoarthritis Awareness Month. So make sure you're sharing on your blog posts, or in your newsletters and with your clients that exercise is the number one thing. And I'll say it's probably number one along with nutrition, maybe number one along with nutrition and mindset. You need all these things. You need a positive mindset that yes, this is going to work, and yes, you are not, or no, you're not tearing down your joints further by doing properly and appropriately prescribed exercises. Number two, that resistance training is one of the best ways to help align and control the joints. And number three, that you want to be consistent with it, and not use just pain as your guideline, like, oh, I'm in pain today, I shouldn't exercise. No. You may need to modify your exercise. You may need to choose a different type of exercise if a specific exercise you're doing is inappropriate and or too painful, but to be consistent with posture, be consistent with movement, be consistent with your exercise program so that you can continue to work on the things that you can control. You can't control pain. You're not going to change pain in people's central nervous system unless you help educate them around the importance of alignment, control. Breathing is a big piece of this as well, because breathing helps decompress the spine. It helps to regulate pressure inside the body, which regulates pressure inside the joints as well. And that's why your clients often say, like, oh, I know when bad weather is coming because my joints start hurting more. I'm sure you've heard that as well. That's a true statement. So pressure inside their joints, we can start to change that slightly and modify that with breathing. So these are the components that you can help your client control to help them address the underlying causes, the root causes of osteoarthritis. Don't chase their pain. Don't, recognize their pain, be aware of their pain. However, also educate them that pain isn't the sign that something is getting better or getting worse. Unless pain is getting worse as they're exercising, then yeah, you want to pay attention to that. But again, you're not treating or addressing the specific pain, you're addressing the posture and movement issues that you're finding and helping them create their most optimal strategy so that they can oftentimes return to the things they need to do, want to do, and ultimately many of the things that they love to do. And that's how you become that go-to specialist. You help more individuals with your approach. And again, it's important that you get out there and educate people. So we have a great resource that we created. Jill, when I say we, here at Integrative Movement Institute, Jill and I, the Two Anatomy Geeks, we created a three-part series around hip and knee osteoarthritis, where we talk about the underlying causes of hip and knee osteoarthritis. I know Sue Gleason and Stephen Schmolt, two of our integrative movement specialists, are part of that series as well. Thanks for being on, guys. I appreciate it. My best friend Pete on here as well. Good to see you guys. Rahul from India is on here as well. So this three-part series on hip and knee osteoarthritis educates you about how osteoarthritis happens, so you can help educate your clients so you feel very confident discussing what osteoarthritis is, because your clients aren't getting this information from their medical professionals oftentimes. Their medical professionals are saying, hey, take this medication, or stop doing exercise, or just get in the pool and just do pool exercise, which is important and valuable, but again, it's not enough. So what are the things that you can do to educate your client? And then more importantly, how do you assess your client for their current strategy? And then how do you create a more optimal posture and movement strategy and take that more optimal strategy and integrate it into the fundamental movement patterns so your client can squat, lunge, bend, rotate, push, pull, and ultimately balance, walk, and carry. So if you're looking for more information, the link is above, below, or next to this video, wherever you're watching it. We'd love to see you. It's a pre-recorded, it's 3 parts, it's probably about 4 to 6 hours, probably closer to 6 hours. There's CECs involved with that series as well. So if you need CECs, it's a great series to get started with, to understand the underlying causes, and more specifically, how do you assess your client, and how do you use the best and most appropriate corrective exercises and functional exercise progressions. So check that out and educate your clients about osteoarthritis. This is Dr. Evan Osar. Thanks for being part of our community and allowing us to share this information. Make sure you get out there and share this information with your clients and your potential clients. Have your clients share it with somebody that can benefit from seeing you as well. Be that specialist that your current clients need and your potential clients are looking for. Thanks so much, Make it a great day. We'll see you next time at Discover IMI. Take care.